excited about networking with you all out there. We're live on Facebook, so we're going to be sharing the show afterwards, and everybody loves that. I'm telling you. Right now, I have my next guest who I've had their other location on, but he's a newbie. He's the newbie, so we're going to be talking about the different location. I have with me Dr. John Marlowe, and he is with Arizona Manual Therapy Centers. Welcome to the show.
Thank you.
Tell everybody a little bit about yourself, and what you do over there at Arizona Manual Therapies.
About myself personally?
Yeah, a little bit.
Yeah,
we got to hear because you're going to be doing the therapy on us.
All right. Well, I'm originally from Kansas City, Missouri, and I went to PT school in Western Kentucky, out in Bowling Green, Kentucky, and then I moved out here because manual therapy actually isn't something that's very big on the West Coast as compared down the Midwest and the East Coast.
Why is that?
Well, a lot of therapy centers out here, they focus more on exercise based, and that's just not, that's something that it's effective, but I feel like manual therapy, it should be the meat of it, just the majority of what you should do. I need to get my hands on patients to get them better.
Now, your location is in Chandler, but there's two locations.
That's correct.
One is in Scottsdale, the other one is in Chandler.
Yes.
And they're rated with the Better Business Bureau. You do free consultations with everybody. When they come into the office, let's talk a little bit about what happens in your therapy, what in the session.
Well, so generally, one of my biggest things is I've got to get my hands on first. Like right away, as soon as a patient comes in, I've got to talk to them. I've got to get my hands on them and feel what's going on and talk to them about what the problem is. You have to assess. You have to constantly reassess whenever you're working with a patient, because especially back pain, neck pain patients, vertigo patients, they come in Monday, they've got pain here, but by Wednesday it may have changed. It may be down here. And so we can't just do the same things we did last time, and I've got to get my hands on some.
What I do know, that there's a lot of people in pain.
That's
you
true.
were here just sitting before the show, and they just heard your name,
right?
And we were talking, and there was at least one or two people that said, I need your card.
Absolutely.
Because a lot of people are in pain, and they've reached out to the furthest extent of what they can do. There's all sorts of things. Manual therapy is different. Do you do other modalities? What kind of modalities do you do there?
Just the typical modalities that you'll get at other places: ultrasound, e-stim, heat, ice, things like that. Little tools in our tool belt to help ease pain and calm things down. But really, the secret to successful physical therapy is getting your hands on someone.
Well, here's what we're going to do. We're going to open up the lines to the audience, if it's okay with you. And what we're going to do is give everybody who calls in a free consultation.
Yeah.
It's a free consultation that you're going to get. And how long is the consultation?
I'll be 15 to 30 minutes.
So about a 30-minute consultation, and what you're going to do is you're going to be able to talk to him about what's going on with you. He'll assess you, and then you can find out what they need to do to help. Then again, I do think that it's, especially if somebody has been in pain for a long time, there's a little bit of progression that they need to go through.
Absolutely.
Before you find out exactly what it is.
Absolutely. And most people, when they're in pain, by the time they finally get to a physical therapist to get my hands on them, they've already gone weeks of waiting to go to the physician, weeks of waiting to get the help they need, and then by the time they get to me, their pain has changed. It may have started with their low back being the thing that hurt a month ago, 2 months ago.
Now they've got a sciatic nerve that's killing them.
Right, that's absolutely right. Or it goes up into their neck and they start getting headaches, and they don't understand why it's turned into these headaches and this pain, and so we just kind of have to peel it back.
So we've got our lines open here. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. They have two locations. One is in Scottsdale, the other one is in Chandler. This is where you're located, is in the Chandler one. You could check them out on their website. It's AZMTC, and that's for Arizona Manual Therapy Center. So AZMTC.com, and you call in here, you're going to get a free assessment of evaluating where your pain is and what they can do for you. Our number here, 602-277-5369. Toll free, it's 1-866-536-1100. And I'm going to let everyone call throughout the rest of the show so that they can get this in on this. And they're rated with the Better Business Bureau. They do for this free consultation. You can call them direct if you want. Their phone number, 480-629-4606, or call in here, get this assessment. It's all about finding out what is your pain, where is it coming from. Our number here, 602-277-5369. And so what you wanted to talk about is a little bit about what makes Arizona manual therapy so different.
Right. So I have worked at other therapy clinics, some bigger chains. First of all, right now, like you said, we're just 2 locations. We've just opened this Chandler office. I took over a month and a half ago there, and we're starting to really build up our patient load, getting good reviews on Google, because we actually care and spend a lot of one-on-one time. And when I was working at these other places, they had me working with 3, 4, 5 patients in an hour, and I feel like the quality of care kind of starts to go down with that. And one of our policies that makes us different is it's one-on-one, and we never schedule more than 2 people per hour.
Wow.
Right? So the physical therapist is with you for at least half an hour of that before you go off and do exercises. But you're never
That's awesome.
not being
because
watched
that's what
by
you
me.
do feel like when you go into this, like a catacall thing.
That's right.
And you watch
That's right.
everybody doing like the little same things as you.
And you watch the therapist, and they're just bouncing from patient to patient
Right.
to patient, and then the tech takes over and they go do exercises. And a big complaints that I would get from patients, which is one of the reasons I wanted to go to AZMTC, is just that they feel like they could do that on their own.
Right.
What's
Why
the
do I have
physical
to come
therapist
here?
doing? He
So
sees me for 10 minutes.
Exactly.
Yeah.
So, and what makes you different? And when you say that, what's your answer to them?
My hands-on.
Mm-hmm.
I've got my hands on you. I've got to feel what's going on. And what the difference is that I'm going to spend more time with you to figure out what's going on. And the biggest thing is I'm going to change the plan. And that's the thing that a lot of these places miss, because they don't spend time with the patients, is you have to change what you're doing based on the symptoms right now.
So you're going to be with them for 30 minutes before you even start doing those exercises
correct.
on your own.
That's right.
They care. They really care, and they really put their heart and soul into making their patients better. That's what it's all
That's
about.
right. That's what it's all about.
They're rated with a Better Business Bureau. They have 2 locations. One is in Scottsdale, and Doctor here works in the Chandler office. You can check them out on their website. It's AZMTC for Arizona Manual Therapy Center, so azmtc.com. You can call them direct if you want. Their phone number is 480-629-4606. Call in here. Get this free assessment. And maybe it's you. Maybe it's someone that you know. And you know what? There's a lot of women out there that are catalysts of everything. So if you're married or, if your significant other, tell them, it's time to take care of it. And a lot of people, they think they have to live with this pain.
That's very true. One of the things that I find, and especially at older adults, is as they age, they come in and they say, well, I thought this was just part of getting older. I thought my shoulder hurting was just part of getting older. And the truth is, no, it's not. Getting older doesn't mean it should be painful. It just means that you've had more time to develop some, imbalances, and now that pain is starting to present.
Now, one thing that you want to talk about is a treatment that people may not want to know about. So what would that be? One here that many people may not know about.
Things that people don't know that physical therapists do is treating back pain, neck pain, headaches, and vertigo. Vertigo is one of the huge ones that we treat that, and we're one of the only specialists that can treat vertigo. Neurologists and physical therapists are trained, especially the DPTs, the doctors of physical therapy like myself, are trained to treat vertigo.
How many people have vertigo?
Lots of people have
And what
vertigo.
are the signs of that?
Dizziness, spinning. It's different than whenever your blood pressure drops. A blood pressure drop will feel lightheadedness, but vertigo is when you look left or right or look up, and then the room starts to spin.
How many people? There's a lot of people out there that might not even realize that you might have vertigo.
That's right.
And it can be helped simply, or how does it work?
It's a very simple and effective treatment. The most I've ever had to treat one person to get past it was 3 treatments.
So
it took about a week.
And it's again manual therapy.
And it's a manual technique that has to be done by hands.
And again, you could check them out on their website. It's azmtc.com. They're rated with the Better Business Bureau. They have 2 locations. One is in Scottsdale. The other one is in Chandler. And right now, we're offering for everybody to get entered. Not entered. They're all going to get. It's a free consultation. They want to talk to you. They want to see what they can do to help you with your pain. Maybe it's you, maybe it's someone that you know. And your pain, you could be living with it for a very long time.
That's right.
Don't have to. Our number here, 602-277-5369. Toll free, it's 1-866-536-1100. Right now, there's a lot of people driving on the road and, they're in their cars. What would you tell them, just as like sitting in the car, one thing that they could do, we're going to go to a break soon, so that they could do just by sitting in the car that might help them with some pain?
Right now, just sit up nice and straight, kind of of bring your shoulders back and see what happens to your back. See if your posture feels a little bit better.
We are going to go to a break, and when we come back, we're going to talk further. Again, our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Call in here and get entered in to win. You don't have to live with pain. So welcome back, everyone. And we are talking right now with Dr. John Marlowe. He's with Arizona Manual Therapy Centers. And while we were on a break, we had somebody that called in that asked a question. And that was, let's say you told everybody that while they were in their cars sit up straight and pull your shoulder back.
Pull your shoulders back.
And the question was, what happens if I do that and my back pops? Is that bad for you? Was that what you said?
Yeah.
Sort of like
so
that.
The question was, I did that and my back popped, and what does that mean? And the reason I suggested everyone in their car do that, everyone in their car that did that, if your back popped, that's a clear indication that your thoracic spine is out of alignment right now, just by your posture, your daily posture, and the way that you're moving.
So let me ask you something. If that happened and it did pop, does that mean that you put yourself in alignment, or so even that little tiny thing, that's better, but when you come into you, what do you do then? I mean, because you're not just going to do that one area. Right. You're going to have to do the entire body, basically.
You can manipulate and move the bones all you want. There are other practitioners that do that, specifically that. But if you don't change the way the muscles are functioning, your spine's just going to get pulled right back out of alignment. And that's something that's very common in people with back pain, is they get that relief from popping their back, right? And that's the facets moving back into the correct position. But the muscles that control your spine, unless you manipulate those and train them how to move properly, they're just going to pull the spine right back where it was.
And that's where you come in.
And that's where we come in. And manually, a lot of my patients, especially the back pain patients, I manually control their muscles, turn their muscles off, and then we retrain using exercises, corrective exercises. We retrain their body how to move the right way and how to be in balance.
Now, we've got our lines open here for everyone to get a free consultation with them, and it's a 30-minute consultation so that you can find out what's going on with your body,
right.
And they are completely different than anybody out there. And what makes you different again?
The fact that we get our hands on you more, and we're manual based. We're not just going to give you therapeutic exercise and watch you work out. We're going to help you with our hands, and we're going to really get in there. And to talk about the consultation, one of the biggest pieces for that consultation is, I'm not one of those people that's going to look at you and say, oh, I can help everybody, because the truth of it is, I can't. There are mechanical problems that I can't fix, and you may not know that you have that. And if you needed an evaluation, we could go further into that. But if I look at an assessment and I say, this is actually something that a physical therapist may not be able to handle, then I'm going to refer you to some specialists, pain specialists, surgeons, things like that we trust, that we work well with. And that's one of the biggest pieces of being a good physical therapist, is having great relationships with physicians in the area.
Also, it's important, though, that you don't just jump to just surgery.
That's right. That's right.
And if anyone's telling you that you need to have surgery, maybe it's a good idea to have a second opinion done,
right.
Where you come in and you talk and you find out exactly what it is that they might be able to do. Mm-hmm. A lot of people don't really know that you're, I don't want to say around, but what makes you so different? They might think that it's just chiropractic, and it's really not.
No, it's soft tissue massage, it's mobilizations of the joints, it's manipulations of the spine. Sure, we do manipulations of the spine, but we also work on the muscles that control the bones. Because, like I said earlier, anytime you move a bone, the muscle has to do that. And so if you're not controlling the muscles using your nervous system correctly, then it's just going to be out of alignment.
Now, their website is AZMTC for Arizona Manual Therapy Centers. They're A+ rated with the Better Business Bureau. They have 2 locations. One is in Scottsdale, and the other one is Chandler. And Dr. John is with the Chandler Center right now. And their phone number direct, if you want to call them direct, it's 480-629-4606. And we're going to leave the lines open here for everyone to keep on calling throughout the rest of the show. Get an assessment. It can't hurt.
That's right.
It can't hurt to get an assessment.
That's right.
And again, that phone number here is 602-277-5369. Toll free, it's 1-866-536-1100. What qualities should people look for then in a physical therapist?
This is a great question. And before I came on the show, you had told me to talk to some of my patients and ask them, what brought you here and what sets us apart. And I actually asked some of my current patients over the last few days, and they said one of the biggest things is you want to look for a physical therapist that's knowledgeable. When you ask them a question, do they answer it right away? Do they look like they know what they're talking about? And do they know the answer? Not just, oh, your shoulder hurts because it hurts. It's, can they explain it to you? Can they really illustrate and teach you? And that's the biggest, I feel, a big key to being a good physical therapist is my job isn't just to fix you. It's to teach you how to avoid that thing happening again.
Well, let me ask you this, Dupe. When people come to you and they've been hurting for years, do you need to have their x-rays, or do you do x-rays? How does that work?
X-rays help. Imaging helps. But physical therapists we have a lot of special tests that we do that isolate muscles and isolate different joints, and we use those tests to diagnose. And the diagnostic accuracy is fairly close to orthopedic surgeons. There's a survey done by the AMA a few years ago.
So let's say someone's dealing with a sciatic nerve, and they've had it for years. Can you fix that?
I can.
You can.
I can confidently say yes. 95% of people I will be able to fix it.
What do you see most in your office?
It's not just knees and hips. I'm glad you asked that.
Let's talk about that.
A lot of people think that we just do rehab after surgery.
It's not measles.
Yeah, that's right. We don't just do rehab after surgery. I love working with backs, necks, headaches, and vertigo. Those are my favorite things to work with. Richard loves working with golf, and he loves working with golfers that have lost swings, and they're not playing the game that they were.
They can't play their golf game anymore.
Right. And correcting posture and correcting deficits are what we do to return people not just to work, but to sports and things like that.
Do you work with children too?
I do work with children and people with neurological deficits. When I was in school, I did a lot of research on balance in the elderly, and balance is one of my huge areas that's one of my favorites, is working on balance.
Let's talk about that. So somebody... what would their symptoms be, let's say, and that they would want to say that a reason to call you for that?
Well, so a lot of times when you're getting older and you feel like my balance is off, you start to lose your balance, or you're noticing that you're falling more often than you were. It may not just be normal part of aging. It could just be because of hip weakness.
That's not normal
It's not
to
normal.
fall.
It's not normal to fall. It's not normal to fall. And a lot of times it stems from hip weakness.
And then let me ask you this too. How about this? Do you need a referral? Do you care?
No. In
Okay.
Arizona is a state that has direct access. And
Do you
direct
take
access.
any insurance?
We do. We take most major insurance.
So they take most major insurance, and people don't think that most people think a chiropractor, and they're not necessarily a chiropractor, but they think of it that they don't take insurance, but you guys do.
Yes, we do.
Most major insurance. So
That's correct.
really, it makes no sense not to get this, as far as I'm concerned. And there's a lot of people out there that are dealing with pain for years. You do not have to. They take most major insurances. You don't need a referral. Can they walk in just right off the bat? I mean, and you do instant
Absolutely.
Consultations with
Absolutely.
them? So they do take walk-ins as well. And we've got our lines open here for everyone to get a free consultation. They want to do an assessment on you, see what they can do for you. The number here is 602-277-5369. Toll free, it's 1-866-536-1100. Okay, so we gave one little, kind of a little something that they can do in their car. What else can they do? One more thing.
One more though.
Let's do something else. What else?
Let's talk about the sciatic patients.
Let's talk about it.
If you cross over your knee over your leg, just
What happens
cross
if you
your leg over.
can't? Because it hurts.
That means that your piriformis is too tight.
Your what?
Your piriformis. It's a muscle that's actually a lot of times traps
What
the
is that?
sciatic
Put
nerve.
that down. Write that down. What is it again?
Piriformis.
Spell it out.
Piriformis.
Okay.
Yes. Piriformis. And that little muscle right there actually goes right by the sciatic nerve. And in a lot of people that have sciatic pain, they have a tight back. Their lumbar extensors are tight, so their back hurts. And then everything down there starts to get tight. The posterior pelvic musculature gets tight. And so that piriformis begins to get tighter and tighter. And it's kind of like squeezing on the sciatic nerve itself.
How many people out there have trouble crossing their legs? I mean, a lot of people that listen to us are older folks,
That's right.
And I'm telling you now, there's a lot of people out there just to cross their legs.
They've got to pick it up with their arm. Got to grab
They
their
do.
ankle with their hand and lift their leg up.
It's crazy.
It is, yeah.
And yet you can help them.
I can.
And the only way you're going to know is by doing an assessment
That's
with
right.
them. Excuse me. They also work with children. The ages starting what? Doesn't matter?
Doesn't matter.
Doesn't matter. What's the youngest patient you've ever worked with?
I've worked with a 3-year-old. That's the youngest I've worked.
So what's the most important thing than people that, are choosing a clinic that they need to look for?
The biggest thing is when you walk in, how does it feel when you look at it? Does it look like herding cattle, or does it look like people that are getting help? Are they seeing, are the therapists that are there, are they bouncing from patient to patient to patient, or are they paying attention to what's going on and how things are changing?
Again, tell them what makes you different. Tell them what you do there, right there.
We have a lot of one-on-one time, and I've got my hands on people. Right away, I get my hands on you to see what's going on. I'm going to ask you how things have changed since the last time I've seen you and change my plan of care and the way that I'm treating you today to try to adjust that. And
Well, you're with him for
better.
You're with him for 30 minutes before you even start doing any of the exercises.
right.
They want to make sure that they're with you and take care of you. That's what they're all about. Their website is AZMTC for Arizona Manual Therapy Centers. They do the free consultation. We're going to let everyone keep on calling throughout the rest of the show to get one from us. They take most major insurances. They've got 2 locations. One's in Scottsdale. The other one is in Chandler. You can call them direct if you want. That phone number is 480-629-4606. But I say, you know what? If you're dealing with pain, you can't cross your legs, they can help you. Why wait? The number to call here, get that assessment is 602-277-5369.